thank you so much for that. Let's head down to the Northeast into Connecticut, which is the last state to begin reopening. Right now, you've got restaurants, shopping malls, and offices in the state that can all get back into business with new restrictions. And in a controversial move there, dental offices can now treat patients for non-emergency reasons. Think about it, your last visit to the dentist, and how much of what was in your mouth went airborne. Never a pretty picture, but in the age of coronavirus, it's a serious concern. So I went to Connecticut to delve into both sides of this story. Connecticut orthodontist Dr. Gary Open is back in business, fully reopening his office today.
We do have quite a backlog. We have been closed for 6 weeks.
The new normal means keeping patients safe in the age of COVID.
We are wearing higher level masks, N95s. We are wearing face shields. Also, we're wearing disposable gowns.
He's overhauled his office, investing in a new air filtration system, significantly reducing the number of patients he'll see each day, and revamping waiting room procedures.
Their temperature will be checked. Once everything is deemed okay, we will escort the patient to the chair where we will be working.
Dental practices are by nature invasive, and preliminary research suggests the coronavirus survives airborne for hours. That's why some industry insiders like hygienist Megan Zadrowski worry dental offices are reopening before it's safe.
Aerosols generated in the dental office are unavoidable, whether it's by dentist drills, whether it's by hygienist instruments, or even the patients themselves who may need to cough.
The American Dental Association has issued national guidelines, including hygienists using hand tools instead of automated devices and limiting drills, suggestions that Zadrowski worries not all dentists will follow. Would you go to a dentist right now for a non-emergent problem?
I would absolutely avoid going to the dental office with a non-emergent service.
A recent national survey by the American Dental Association found 3 in 10 dentist offices didn't have any supply of N95 masks, and nearly 18% had no face shields. Connecticut dentist Dr. David Fantarella says it has been a challenge.
We do have what we need. It has not been easy.
He's invested beyond the guidelines, including a fogger to clean rooms and a mobile UVC unit to reduce pathogens. You understand why people are nervous.
For sure, I'm nervous, but I'm also nervous on the flip side of that. If we don't do anything, what about that patient?
That they get really sick.
That they get really sick.
All dentists facing the new reality that being afraid of the dentist means something different now.
I wanted to make sure my child was safe and comfortable in a setting outside the home.
What are you looking forward to most when all this is over?
Well, getting my teeth straight, definitely.
The challenge of reopening a business when it's anything but business as usual. And there is a major business consideration here. One study suggesting that 46% of dental offices around the country would close if they aren't reopened by the end of August. And the Labor Department says dentist offices lost 500,000 jobs just in April, more than a third of the total number of lost jobs throughout healthcare. Some hygienists who are not returning to work because of safety concerns say they are being replaced. Let's bring in our doctor on duty for the hour, Dr. Libby Roy. She is an internal medicine physician and NBC News medical contributor. So much to talk about, but let's start with one more financial consideration, Dr. Roy, for dentists. The doctors I spoke to have long-standing practices. They can afford to make the investments we showed you. Not all dentists can. Even with those safeguards in place, to put it simply, do you think that dentists are sometimes reopening before it's safe?
Good morning, Chris. It's so good to be with you again. You know, in medicine, we know that oral care is health care. So it is important for all of us to make sure that our oral or dental health is up to speed, up to par. That said, we of course want to make sure that the patients and the public are healthy and safe as possible before they go to the dentist. You know, it's reassuring that the ADA, the American Dental Association, has posted guidelines to reduce the transmission of the virus. But again, there is some concern, as you heard it in the story that you nicely reported, that those particles, those respiratory particles, they will inevitably get out into the air. And dentistry by nature is invasive, so it's going to be a fine balance in terms of really maximizing the safety in a dental office.
Yeah, those air filtration systems are the things that came up again and again and again with people I talked to. And Dr. Fantarella, who was doing emergency procedures before this, told me he had patients call after the fact to say they actually tested positive for COVID. So I'm wondering how much can implementing temperature checks safeguard dental office workers? How much can those other things be safeguards? And taken in total, does it need to be sort of a total approach?
Yeah, so the short answer to that comment, Chris, is yes. It really needs to be a comprehensive approach in terms of maximizing safety and reducing transmission. Remember, at the end of the day, what we want to do is reduce the transmission of the virus as much as possible. You mentioned the temperature checks. You know, there are a lot of businesses that are doing that, but frankly, that's going to miss a lot of potential cases, because remember, most people are still transmitting this virus in an asymptomatic way, so they're not going to exhibit any symptoms. And there are many people who have coronavirus who don't have fever at all. So that's one measure possibly, but it's gonna miss a lot of people. The UV lights, as you mentioned in your report, could be a possibility, but I think really that, you know, you're not going to be able to do the physical distancing. We know that's the most effective measure, but it's going to be impossible in a dental setting. But I think wearing the masks for the staff, obviously impossible for the patient, is going to be one key factor.
Yeah, and the ADA obviously is going to be following all of this. I want to ask you about one more thing that we learned about in the last 24 hours for the first time in months since all this started. Some New York hospitals are going to allow families to visit their loved ones. It's just a 2-week pilot program to see how it goes. The visits have a time limit. Visitors have to wear all that protective gear. But as a doctor, can you talk about the importance of this, both for the patient, for their mental well-being, as well as for the families who obviously are very concerned that their loved ones are spending a lot of time in isolation?
You know, Chris, this is such an important topic, and it's been unprecedented all my years of practicing medicine, and I've been a patient even before that, and a family member. Look, as a personal story, when my parents came to visit me in New York last year, my father was unfortunately hospitalized, and you know, but all of us, the entire family, got to visit and sit at his bedside every single day as he was getting so worried and anxious. That connection, being at your family member's bedside, is such a critical one. And as a result, because of the nature of this disease, it's so infectious that for safety reasons, we have not allowed family members. But if we can change settings such that it's safe for family members to don the protective equipment and be at their loved one's bedside, I think that says a lot. It also reduces the burden on healthcare workers who've been not only doctors and nurses and medical professionals, but they've also been these, I guess, ad hoc family members as well during this very surreal time.
Yeah, and as we've all learned, as great as some of the technology is, you know, that they've been able to take and FaceTime the patients with their parents, there's no substitute for that face-to-face. We'll be watching how that goes. Dr. Roy, thank you. You're going to stay with us. I'm glad about that through the hour.